Okay, this chapter we're going to talk a little bit about cultural diversity, but we're going to actually talk about in healthcare in a thinking about leadership and management roles. And here are your learning objectives for this chapter. When you think about cultural diversity, again, there are two things you want to think about: the patients and the workforce. So nurse leaders and managers are going to be concerned with cultural diversity from those two perspectives: the care of a diverse patient population, but also positive work experiences in a culturally diverse workforce as well. There's some national and global directives that are directed towards cultural diversity in the ANA Code of Ethics for nurses. This provision is going to help the nurse to recognize that healthcare needs to be or must be provided to culturally diverse populations in the United States and on all continents of the world. Causes of disparities in healthcare include poor education, health behaviors in the minority groups, inadequate financial resources, and environmental factors. Your disparities in healthcare that relate to the quality of care are going to include provider-patient relationships, actual access to care, and treatment regimens that necessarily reflect current evidence, provider bias and discrimination, and even mistrust of the healthcare system and refusal of treatment by the patients. And then sometimes also the doctors as well. Health disparities in ethnic and racial groups are observed in cardiovascular disease, which is about 40% higher incidence in the United States for blacks than in the U.S. whites. Cancer usually has a 30% higher death rate for all cancers in U.S. blacks than in U.S. whites. And Hispanics with diabetes who are twice as likely to die from this disease than your non-Hispanic whites. So consider how these disparities in disease and in healthcare services might actually affect the healthcare providers in the workplace in relationship to their ethnic or racial group. So it's necessary to increase healthcare providers' knowledge of these types of disparities so that they can be more effectively managed and they can treat diseases related to ethnic and racial minorities, which increasingly might include themselves as well. Staff who know what is valuable to patients and to themselves can usually act accordingly and derive some satisfaction from work. Having a clear mission, goals, rewards, and acknowledgement of efforts can lead to greater productivity from a culturally diverse staff who aspire to have unity and a uniqueness. Cultural background stems from one's ethnic background, socioeconomic status, and family rituals, to name just three key factors. Ethnicity, according to the dictionary, is defined as related to groups of people who are classified according to common racial, tribal, national, religious, linguistic, or cultural backgrounds. And so this description differs from what is commonly used to identify racial groups. So this broader definition is going to encourage people to think about how diverse the populations are just here in the United States. When it comes to diversity, this term is used to describe a vast range of cultural differences among individuals and groups. Cultural sensitivity is going to describe the affective behaviors in individuals, the capacity to feel, convey, or react to ideas, habits, customs, or traditions that are going to be unique to a group of people. Acculturation is socialization referring to growing up within a culture and taking on the characteristics of that group. All of us are socialized to some culture. Acculturation refers to adapting to a particular culture. The overall process of acculturation into a new society is usually very difficult. Assimilation refers to the change that occurs when nurses move from another country to the United States or from a part of the country to another part. They're going to face different social and nursing practices. Individuals now define themselves as members of a dominant culture. So an example of this might be when a nurse no longer says that they are from their country or of origin. They say that they are from where they live and practice. Nurse leaders and managers who ascribe to a positive view of culture and its characteristics effectively acknowledge cultural diversity among patients and staff. So this includes providing culturally sensitive care to patients while simultaneously balancing a culturally diverse staff. So example would be of cultural diversity might mean being sensitive to or being able to embrace the emotions of a large multicultural group comprising of staff and patients. Unless we understand the differences, we can't come together and make decisions that are best or in the best interest of the patient. The first individuals in most organizational structure who have to address cultural diversity are the leaders and the managers. They have to give some type of unwavering support to embrace diversity in the workplace rather than using that standard cookie cutter approach. Creating a culturally sensitive work environment is going to involve a long-term vision and financial and healthcare provider commitment. So leaders and managers need to make a strategic decision to design services and programs especially to meet the needs of diverse cultural, ethnic, and racial differences in the staff and the patients. There are mentoring programs that can help staff to expand their knowledge of cultural diversity and help them to recognize their own biases while integrating them in diverse colleagues, or with diverse colleagues, Continuing education programs can help nurses learn about caring for different ethnic groups in ways that honor their beliefs. There's also internet websites that can help nurses quickly and effectively obtain information on different cultural topics that they could use on a day-to-day basis. Okay, that's all I have for this chapter.